afternoon. The 2022 Ohio Nurses Foundation's Nurses Choice event will begin momentarily, but first I'd like to take the opportunity to thank this year's sponsors. Under Platinum Plus, we have Mid-Ohio District Nurses Association. Under Platinum, we have NSO, Arthur L. Davis Publishing, Health eCareers, Francis Payne Bolton School of Nursing at Case Western Reserve University, Cloppert, Latanic, Sauter, and Washburn, The Ohio State School of Nursing, and Quantum Health. Under Gold sponsorship, we have California Casualty, Kent State University, College of Nursing. Under I Love Nurses sponsorship, we have Southwestern Ohio Nurses Association, who are a double sponsor this year, District 3 Nurses Association, who wish to honor Mary Ellen Patton and nurses everywhere, and lastly, Ohio State University's Nurses Organization.
And welcome to the 2022 Nurses Choice event. For those of you who don't know me, I'm Lisa Oakes, President of the Ohio Nurses Foundation and CEO of the Ohio Nurses Association. It is such an honor to be celebrating exceptional nurses and future nurses today. Last year was the first time we celebrated the Nurses' Choice virtually. We were so pleased to be able to celebrate the accomplishments of awardees and make their work known throughout social media that we decided to stay virtual this year again. I also want to thank our many sponsors of this event who make it possible for our foundation to offer these scholarships year after year. But before we announce scholarship awardees, I want to take a minute to thank our ONF board members for their commitment to supporting the mission of the nursing profession and helping to support new and existing nurses at such a critical time. We also want to encourage our viewers to participate in our first ever virtual Facebook fundraiser. Look for a link in the comments to easily donate to future nursing scholarships. We know that nurses are the backbone of healthcare, and now, more than ever, the nursing profession is in need of new committed nurses. With 40% of nurses considering leaving the bedside, the time is now to support current and future nurses. And without further ado, let's get started. Today's first scholarship is the Hague Memorial Scholarship. Our sponsor, Cloppert, Latanic, Sauter, and Washburn, will present this award.
Hi, I'm Laura from the law firm of Cloppert, Latanic, Sauter, and Washburn, here with you today to announce the winner of the Hague Scholarship. The Hague Scholarship is for a graduate nursing student who is an aspiring nurse leader. This year's winner is Monica Steibel. Congratulations, Monica, and thank you to all the nurses out there for all that you do.
Hi everyone, my name is Monica Steibel and I am the recipient of the Hague Memorial Scholarship. I first became a nurse because I love caring for others and watching others improve medically and in their everyday lives. I'm currently at Ohio University pursuing my DNP with the hopes of becoming a psychiatric nurse practitioner. During the recent COVID pandemic, I've been working in the emergency room, and upon graduation, I hope to continue working in the ER, caring for mental health patients in crisis. Thank you again so much for allowing me this opportunity to receive this scholarship.
Congratulations, Monica. The next scholarship is the ONF's Minority Scholarship. To present this scholarship, please welcome another event sponsor, the Ohio State University College of Nursing.
Hi, everyone. I'm Bern Melnick, and I have the privilege of serving as Ohio State's Vice President for Health Promotion, University Chief Wellness Officer, and Dean of wonderful College of Nursing. Our college is a leader in academics, research, wellness, innovation, and evidence-based practice. Our terrific students, faculty, and staff work every day to dream and achieve the impossible to transform health and improve lives locally, nationally, and globally. I have the honor of presenting today the Minority Scholarship. This scholarship is for students from underrepresented populations who are pursuing their first nursing degree that leads to RN licensure and live in the state of Ohio. I'm really excited and pleased to announce that this year's winner of the Minority Scholarship is Riley Page. Congratulations, Riley. Keep on dreaming, discovering, and delivering.
Hi, I'm Riley Page, and I am a recipient of the Minority in Nursing Scholarship. I'm a sophomore at University of Cincinnati, and I decided to be a nurse because I've always had a huge passion for helping people, and I wanted my career to have a direct impact on people's lives. As a nurse, you're able to see firsthand how your work positively impacts people, whether that's through treatments or just being there for someone emotionally. I'm so excited for my future career in nursing.
Congratulations, Riley. RN's Majoring in Nursing Scholarship is up next. Presenting this award is our sponsor, Quantum Health.
Hi there. My name is Nissa Toller, and I'm a registered nurse. I have been a registered nurse for 12 years, 8 of which I've been here in Dublin, Ohio at Quantum Health. Just to tell you a little bit about our company, Quantum Health is a healthcare navigator. That means that we pursue every option we can to break down any barriers for our individuals who are on a healthcare journey. I am so fortunate to support almost 140 telephonic nurse case managers here at Quantum Health. This team works tirelessly with our members from Florida to Alaska. They assist their members, again, in understanding their healthcare journey, navigating it, educating them, and most importantly, supporting the member and their family as they go through their diagnosis. We are so lucky to work here at Quantum Health, and it is a great place to work. Now, we want to talk about a great scholarship that is about to be handed out. I would like to announce the scholarship for registered nurses majoring in nursing scholarship who are already registered nurses and who want to advance the profession of nursing here in Ohio. So without further ado, the winner of the registered nurse major in nursing scholarship is Brian Glenn. Congratulations, Brian. Thank you so much for allowing me to be here.
Hi everyone, my name is Brian Glenn. I am a recipient of the 2022 RN's Majoring in Nursing Scholarship. I'm definitely very appreciative of the Ohio Nurses Foundation for selecting me for this particular scholarship. I am a Master's of Science in Nursing student at Ursuline College here in Cleveland, Ohio. I chose the profession of nursing after seeing the lack or substandard nursing care that my grandmother received prior to her dying.
Congratulations, Brian. Each year, the Ohio Nurses Foundation offers the Students Returning to School for Nursing Scholarship. To present this scholarship, please welcome event sponsor, the Francis Payne Bolton School of Nursing of Case Western Reserve University.
Hello, my name is Rebecca M. Patton from the Francis Payne Bolton School of Nursing at Case Western Reserve University. Located here in Cleveland, Ohio, it's the home to some of the best healthcare systems in the world. FPB's approach to nursing education is rooted in immersive, practical learning designed to give students a real-world experience starting their very first semester. As nursing scope has grown, our faculty and staff have made an effort to pursue areas of research and growth in focusing on community and public health, addressing the social determinants of health, and improving the access to and equity in healthcare. The world needs more nurses, and that's why I'm excited to announce the recipient of the Ohio Nurses Foundation Scholarship for students returning to school for nursing. This scholarship is for students who've been out of school for more than 2 years and who are not currently RNs. The winner of the Students Returning to School for Nursing Scholarship is Nathan Sabo. Congratulations, Nathan.
Hello, my name is Nathan Sabo, and I am the 2022 Student Returning to School for Nursing Scholarship winner. And I would like to give a sincere thank you to the Ohio Nurses Association and Foundation for the scholarship that I received. I am currently a student in the Fast Track Nursing program for my BSN RN at Walsh University. And I plan on going into psychiatric nursing since I've been working with Cleveland's Poor on the west side for a number of years now. I recognized what kind of a need there was for helping our individuals in that area with psychiatric nursing, and I'm proud to become a nurse in the near future. So once again, I'd like to thank the Ohio Nurses Association and Foundation for the scholarship, and well wishes to all of you. Thank you.
Congratulations, Nathan. Our next scholarship is the Traditional Nursing Student Scholarship. Thank you to Arthur L. Davis Publishing Agency and Health eCareers for sponsoring this award presentation.
Hello, I'm Stephen Miller of Arthur Davis Publishing Agency and Health eCareers. We are the nation's premier resource for nursing publications, careers, and events. For nearly 40 years, we've partnered with amazing organizations across the country, and today we reach over 3 million nurses nationwide. We are the proud publishers of the Ohio Nurse and have been working with ONF and ONA for 15 years. We are honored to announce the Traditional Nursing Scholarship. It is meant for students who do not have breaks longer than 2 years in their formal education from high school to college and have not yet obtained their degree. There are 2 winners of the Traditional Nursing Scholarship this year, and I am happy to announce that the first is Abby Arledge. Congratulations, Abby, and best of luck in your career.
Hi, my name is Abby Arledge and I attend the University of Cincinnati. I was awarded the 2022 Traditional Nursing Student Scholarship, and I would love to thank the Ohio Nurses Foundation for this scholarship.
Congratulations, Abby. This year, we have a second Traditional Nursing Student Scholarship to award to another deserving student. Please welcome back Stephen Miller to present this award.
Hello, I'm Stephen, again, of Arthur Davis Publishing and Health eCareers, the nation's premier resource for nursing publications, careers, and events. As I mentioned, for 40 years, we've partnered with organizations like ONA and ONF across the country, and today we reach over 3 million nurses nationwide. We publish the Ohio Nurse and have done so now for 15 years, and we're proud to work with organizations like ONF and ONA. The second winner of the Traditional Nursing Scholarship is Haley Wally. Congratulations, Haley. We wish you well.
Hello, my name is Haley Welly. I'm a second-year nursing student here at Capital University. I was awarded the Traditional Nursing Student Scholarship, and a little bit about why I want to be a nurse and wanted to go to nursing school was because I've always just loved helping people. Ever since I was younger, I was always a compassionate person, always trying to do the best to make the other people feel better. I'm a very comforting person, and I'm excited to make a difference in the world, and I just wanted to say thank you to the Ohio Nurses Association for this opportunity.
Congratulations, Haley. And now I would like to invite Penny Lynn Rowland, President of the Greater Cleveland Nurses Association District of ONA, to present the St. Luke's Scholarship.
Hello, my name is Penny Rowland, and I am the President of the Greater Cleveland Nurses Association. In 2021, the Greater Cleveland Nurses Association worked with the Ohio Nurses Foundation to establish criteria for the St. Luke's Scholarship. This scholarship is made possible through a generous gift from the St. Luke's Nursing Alumni Association. In honor of all proud diploma nurses, please consider donating to the St. Luke's Scholarship Fund. Donations can be directed to the St. Luke's Alumni Scholarship Fund by specifying the fund when donating. This year, 2 $1,000 scholarships are being awarded. The first awardee is Heather Kaloff. Heather is enrolled in the Accelerated BSN program at Cleveland State University. In her application for the scholarship, Heather wrote that she plans to advance the nursing profession in the state of Ohio by helping to influence change that will reduce nurse burnout and improve the work-life balance of all nurses. Through her work, she hopes to increase morale, motivation, and productivity. Congratulations, Heather.
Hello, my name is Heather Kaloff, and I'm a proud recipient of St. Luke's 2022 Scholarship. I'm currently attending Cleveland State University for Accelerated Nursing, and the reason why I chose to be a nurse is due to current events. The COVID-19 pandemic highlighted a lot of problems that are in the nursing field. One of them is the shortages. I want to help alleviate the all-time high workload that nurses today are experiencing. Thank you. Bye.
Congratulations, Heather. This year, we are awarding a second St. Luke's Scholarship, so please welcome back Penny Lynn Rowland to present this award.
The second St. Luke's Alumni Scholarship goes to Sheila O'Connor. Sheila is in the Accelerated BSN program at Baldwin Wallace University. She was a performing arts music teacher for 15 years before pursuing a career in nursing. She enjoys bringing her passion for people to nursing. She aspires to apply her leadership, organizational, and communication skills to create a culture of warmth and acceptance wherever she works. Congratulations, Sheila.
Hello, my name is Sheila O'Connor. I am the recipient of the St. Luke's Scholarship. I currently attend Baldwin Wallace University, and nursing is going to be a second career for me. I originally was a music teacher for 15 years, and I decided to go into nursing because I want to directly impact a family and their medical journey. So I think that it would be really great if I could be a liaison and someone who represents that family and the patient and communicates with them and with the medical staff in a hospital or any care setting to make them better. So that's why I want to be a nurse. Thanks.
Congratulations, Sheila. Each year, we present the Gingy Harshey Mead Excellence in Leadership Award to an individual or organization in recognition of sustained commitment to the nursing profession and or participation in and contributions to the purpose of the Ohio Nurses Foundation. Now it's my pleasure to introduce a fellow ONF board member, Benitha Garrett, to present this award.
Everyone, I am Benitha Garrett, the Secretary of the Ohio Nurses Foundation. It is my honor to read the acceptance speech from this year's Gingy Harshey Mead Award recipient. On behalf of the entire team of Homage, it is our honor to accept this year's Gingy Harshey Mead Award. Nurses are the backbone of the medical profession, and Homage is proud to support Ohio nurses through our Homage Works initiative, which raises funds for the Ohio Nurses Foundation. Nurses are our family, members, friends, and neighbors, and we're grateful for their dedication, courage, and commitment to their patients and the health of our community every day. Thank you for all that you do.
For centuries, nurses have been at the forefront during times of war, strife, and peace, caring for those in need. As far back as Florence Nightingale, nurses have been going above and beyond, giving of themselves, and in many cases, risking their lives to save others. We have seen this time and again during the pandemic, where many paid the ultimate price with their lives. Being a nurse is so much more than a job. It is a calling. In today's world, it is harder than ever to be a nurse during a time where hospitals, at-home care businesses, nursing homes, university and school systems want more for less and are willing to cut corners for profits. To nurses who have made a serious commitment to their profession, they are often asked to take shortcuts or to serve more patients with less time, leaving them with moral injury. Last year, the Ohio Nurses Foundation awarded a grant up to $100,000 to research the effects of moral injury in nursing. Today, we are proud to invite back the recipients of this grant to share more of their findings.
Hello, I'm Joyce Fitzpatrick from Case Western Reserve, and we're here to share our research project, Narrative Nursing Intervention, Effects on Moral Injury, Resilience, and Well-Being among Ohio registered nurses practicing during COVID-19. I'd like to share with you our research team from Case Western Reserve, The Ohio State University, and the University of Cincinnati. As I mentioned, I'm Joyce Fitzpatrick. We also have Dr. Grant Pignatello from Case Western Reserve and our doctoral student, Jessica Tabla.
Hello, my name is Jin Jun. I am an assistant professor from the Ohio State University College of Nursing, and my research focuses on systems level intervention as well as individual level intervention for nurses' well-being.
And my name is Sharon Tucker. I too am from Ohio State University College of Nursing. I am the Grace Sills Endowed Professor of Psychiatric Mental Health. And I study research, behavioral interventions, mental health interventions that promote health for women, children, and families, also employees, including nurses. We also have Dr. Donal Omahuna, who is on our team from Ohio State. He is unable to be here today, and his research is in the area of ethics, humanitarianism, and he's certainly been an important player during our COVID pandemic.
Hello, my name is Minjin Kim. I'm an assistant professor in the College of Nursing at the University of Cincinnati. My research focuses on using digital narrative like storytelling and AI technology interventions to address health disparities and health equity. We also have a PhD student, Henry Dubois, part of this project.
Our project was funded by the Ohio Nurses Foundation, and we extend our thank you to ONF. And I'll turn it over to my colleague, Dr. Sharon Tucker.
Thank you, Dr. Fitzpatrick. This project is founded in a series, whole decades of research that has demonstrated that nurses have stressful positions. And their stress is associated with health behavior and health outcomes. And as one becomes more stressed, it appears health behaviors decline, and that leads to poor health outcomes. And we know from multiple studies that not only does that impact health outcomes, but there are data to suggest nurses self-report that they're more likely to experience or report a medical error if they indeed are more stressed and they have poor health ratings. We also know from research that consistently for over 10 years that nurses have higher suicide rates among their population than compared to the general population. And what we have been concerned about prior to COVID is the impact of stress, exhaustion, burnout, depression, anxiety, insomnia, and psychological distress, which you can see on this slide, ranges anywhere from a quarter of our nurses to higher. And it's not just nurses, it's healthcare workers in general. And also of concern I mentioned is the suicide incidence, which has been rising for nurses, but we're also concerned among other healthcare populations, including physicians. And while there is considerable documentation on the effects of COVID among nurses and others regarding their mental health at the national, regional, and state levels and worldwide levels, we have little research to date that has demonstrated interventions to address moral injury and moral distress as well as mental health challenges. And we need interventions to mitigate the effects of moral injury for nurses and other healthcare providers. When we think about moral injury and moral distress, they're very closely related, but they're separate. So we think about moral injury as a deep sense of moral transgression that is accompanied by an a number of different emotions that are more negative emotions like shame and guilt and feeling regretful, remorseful, and a sense of betrayal from the people that you look to support you as a nurse, that a betrayal of what is right by oneself and what one thinks is right is inconsistent with what their experience is, and it significantly impacts their sense of self as well as relationships. And as I mentioned, this is closely related to moral distress, which is sort of the step before moral injury. And it's when there's an ethical course of action determined because there's a dilemma, a moral or ethical dilemma, and the nurse or other provider is unable to act on what they believe is the right thing to do because of constraints in the internal or external environment. And it leads to significant emotional distress when we can't act upon what we think is the right thing to do. And over time, though, if that becomes where we feel betrayed and unsupported, it can lead to serious injury, which is referred to as moral injury. And this is important for us as a nursing profession and as a research team because our nursing code of ethics clearly states that the nurse's primary commitment is to the patient. So when they're not able to do that, it creates this distress, and it also violates our code of ethics. And the nurse certainly owes the same duties to self as others. And then lastly, that nurses can provide care to a higher volume of severely ill individuals while also lacking sufficient clinical and personal resources, that all can lead to moral distress and moral injury. So closely related to that, and also related to institutional support, is resilience. And a nurse's sense of resilience has been negatively associated with depression and anxiety. So it is a protective factor, in other words. It in and of itself is insufficient. We need to also support institutional strategies, but social support from families has also been associated with increased resilience. So we know there are strategies that can help a nurse cope and feel stronger and reduce their sense of or their risk of depression and anxiety. But we continue to need interventions to really enhance resilience. Of course, we've got mental health problems, we have moral distress and moral injury, we have resilience that can help protect, but all of this can lead to burnout, and it often does. Burnout is a syndrome that occurs over time from chronic workplace stress, and it's characterized by total exhaustion, losing a sense of meaning in one's work, and a sense of real achievement or effectiveness in their work. Even before COVID occurred, we were worried about burnout among nurses and other healthcare providers, and that led to a white paper by the National Academy of Medicine around let's explore the factors that contribute to and mitigate burnout as a national research priority for healthcare workers, physicians, nurses, and others in general. So those combination of variables can lead to an outcome that, of course, we as a profession of nursing don't want to see, or other healthcare professions want to see, and that is leaving one's unit, leaving one's institution, or leaving one's profession entirely. And the strongest predictors for nurses' intent to leave are their feeling exhaustion, burnout, are also feeling staffing inadequacy and feeling workload that's just not manageable. So it's really important for us to examine nurses' intent to leave and to explore the effects of various interventions, including the narrative nursing intervention, on their overall mental health, stress, burnout, and intent to leave.
So in our study, we use narrative nursing intervention and peer support approach. Narrative or storytelling is one of the most basic forms of narrative communication that has been used to transmit ideas, values, identity, culture. The purpose of using narrative or storytelling is not only to describe a situation, but also to motivate people to act in a certain way. So people who tell stories have a need to share their thoughts, feelings, and information with others, and to create a meaning about an event or situation. And also, storytelling can be therapeutic as patients use their personal stories to make sense of and understand the situation in which they can find themselves in the therapeutic settings. narrative intervention can also capture everyday examples of practice, generate powerful curricular products that support reflection, deep understanding, and critical thinking. The peer support approach occurs between people who share similar life experiences that provide mutual support, advice, empathy, validation, and sense of belonging and community. And storytelling comes in naturally to facilitate peer support, to develop trust relationship and build cohesion. And also Dr. Fitzpatrick and her colleague in other study highlights that the stories of the essence of nursing help nurses to share their culture and practical wisdom and inspire their shared vision of what it means to be a nurse. So when peer approach is used in developing narrative intervention, it allows peers to feel less shy, like nervous, discussing and sharing their personal experiences, feelings, and thoughts. So when peers use their personal stories, it encourages others to share their own stories and examining their emotions, problem-solving skills, goal setting, like develop strategies to manage their illness and exchange social support. So combining the narrative interventions with the peer support approach is relevant and has a potentially effective tool to promote healing by understanding and making sense of nurses' experiences, creating a sense of connectedness, and providing personal resilience and increasing coping and decreasing stress. Now I'm going to turn it over to Dr. Jin John.
So my colleagues have shared the background and the significance and the purpose of our study. So in order to achieve our study goal, we have research questions which are asking the levels of moral injury, well-being, resilience, and burnout, and as well as intent to leave nurses' position and profession among Ohio registered nurses engaged in clinical practice during COVID-19 pandemic. So we have two phases of the study. The first phase is a descriptive quantitative assessment of these constructs. So it was done by using an online survey. And to be included in the study, nurses had to be engaged in actual clinical practice during the COVID-19 and also practicing in the state of Ohio. And those nurses who are employed by staffing agency or employment agencies were excluded. When we calculated the power analysis to adequately power our sample, we have found that we need at least about 482 participants to detect a small relational effect. So to measure the constructs that we were interested in, these are the measurement tools that we have used to measure moral injury. We use moral injury symptom scale for healthcare professionals, as well as we use nurse well-being scale and resilience scales. And we also use a burnout measures. We use the one item question to ask about burnout. And we included the questions about nurses' intent to leave. We also included background demographic data that included basic information about the sex, age, category, and also where they practice, because we included nurses from the entire state of Ohio. We did ask for their primary work and zip code, and we calculated their geographical location. So data collection process was started with an email invitation that was sent to the nurses who belong to the Ohio Nurses Association. We used the generic listserv, so we did not have an individual emails. We also used the alumni listserv from the 3 large universities that are located in the state of Ohio. Nurses received the study information through the ONA newsletter that had the link embedded to it. So if they were interested, they were able to click the link in order to participate. And we kept the survey open for about 10 weeks from June, July, and August of 2021. And there was no incentive that was provided for participating in this online survey. And that was phase 1 of quantitative. And for our phase 2 of the data, the study procedure was narrative nursing intervention, and this was a facilitated workshop in which the participants actively participated and shared their stories, and their stories were video recorded, and the stories centered around their experience during COVID-19 that may have caused stress or moral injuries that they could recall. And those exemplify nurse-patient relationships or may even be nurse-to-nurse relationships. And the narrative nursing intervention focused on the active listening as well as the active telling of the story. And following the workshop, the videos that we recorded of the nurses that are sharing the story, those videos will be recorded and divided into segments in which that the research team will be able to identify the most salient and relevant story units. So the small stories that we could share with the other nurses that were not able to actively participate in the interventions. And these final videos will be saved as a digital file for the phase 3 of the project. So for the phase 2, this active narrative nursing intervention, the research question that we were asking were what are the effects of narrative nursing intervention on our primary outcome of interest, which are once again moral injury, well-being, resilience, and our secondary outcome, which were burnout and intent to leave position, as well as their profession among the same sample of Ohio nurses engaged in clinical practice during COVID-19. And because our sample size for phase 2 during the intervention phase, it's much smaller. Our target sample size is 45, but with these participants, what we are doing is a pre and post intervention survey. So before they participate and share their stories, we are collecting data on their moral injury, well-being, all the outcomes that we already talked about. And also we're measuring the same outcomes after the narrative nursing intervention and compare what are some of the differences and to answer our research question. So both phases, the phase 1 and phase 2 of the studies are replicable in a number of different venues with registered nurses, not just in the state of Ohio, but elsewhere, and also not just nurses, but other healthcare professionals. We do know that the COVID-19 has been a challenging time, not just for nurses, for all of us that are in healthcare, as well as nursing students and medical students and different professional backgrounds. And these replications will be, or can be undertaken at local, state, and national level. So these are some of the references that we have used, and that is the end of our presentation, and thank you for your attention.
I want to thank Joyce and all of the researchers that have worked on this meaningful grant. Your efforts and findings are priceless, and the ONF board and I look forward to receiving your final report regarding this project and where you go from here. It is now my privilege to introduce an energetic and passionate nurse educator and member of the Ohio Nurses Foundation. Please join me in welcoming Taylor Mullen.
Hello, everyone. As Lisa mentioned, my name is Taylor Mullen, and I'm proud to be a member of the ONA Board of Directors and an ONF member. I'm a full-time faculty member at Capital University, and I also work part-time in the operating room at the James. As a student working toward my PhD, I definitely understand the financial challenges and pressures nurses face to continue their education while trying to limit their financial debt. That is why it is imperative that nurses and those studying to be nurses have access to financial scholarships that help offset their expenses. When you donate to the Ohio Nurses Foundation, you are supporting the future of nursing. We are at a critical time in our profession where good nurses are needed more than ever. Good nurses are desperately needed at the bedside, at universities, and in long-term care and in every aspect of nursing. Unfortunately, concerns about financial debt can often hinder nurses and future nurses from seeking more education. With your help, we can change that. 100% of your contributions will go directly to providing scholarship support to nurses and future nurses. Ohio Nurses Foundation is committed to working toward offering meaningful scholarships that make a difference. Please give today. When our loved ones are in need, we want to make sure that they have the best care possible, and that starts with nurses getting the support they need first. Just click on the button to donate below or go to ohionursesfoundation.org. On behalf of Ohio nurses and the Ohio Nurses Foundation, thank you for making an impact.
Thank you, Taylor, for your leadership and for supporting the mission of the Ohio Nurses Foundation. This concludes the 2022 Nurses Choice event. Congratulations again to all of our recipients, and thank you for celebrating with us today.